A patient today asked about a medication called Wellbutrin or Bupropion. They said that they heard that this medication can treat major depressive disorder, but that it doesn't have some of the side effects that individuals may get with SSRIs or SNRIs, some of the other antidepressants out there. Wellbutrin or Bupropion is a medication that, unlike your SSRIs or SNRIs, it increases the availability really of norepinephrine and dopamine as opposed to primarily serotonin. Wellbutrin tends to, for a lot of patients, really increase energy and motivation and also focus. And it's used actually at some of the higher end doses, often in individuals that have ADHD and who may not even have a mood disorder, just because it does have a stimulant-like effect, but doesn't tend to have the abuse potential that Adderall, Ritalin, some of those medications may have. Wellbutrin, as mentioned, may not have some of the side effects that other antidepressants have, and specifically, it actually doesn't tend to have the sexual side effects that some of the SSRIs or SNRIs can have. And for many individuals, it can actually counteract those side effects. And so sometimes when an individual is on an SSRI or SNRI, this will be added to actually counteract those side effects. It's a medication that, just like all medications, has potential side effects. And what a lot of people don't often realize is that although often antidepressants or many antidepressants can improve anxiety, Wellbutrin doesn't tend to treat anxiety. And for many patients, it actually can make it a lot worse. So someone may start this medication and say, oh my gosh, I started having panic attacks, or I started feeling really revved up or jittery, or like I had a few cups of coffee, or even angry or volatile in terms of their mood. And so it's important for providers, for patients, to keep an eye out for that if a patient starts Wellbutrin. It also tends to lower the seizure threshold more than most antidepressants. And so if a patient has a history of a seizure disorder, if they have a problem with alcohol use disorder where they may be vulnerable to withdrawal or withdrawal seizures from alcohol, if they have an eating disorder where due to electrolyte abnormalities or fluctuations, they may be more vulnerable to having seizures, many providers will often avoid this medication, which certainly makes sense. And just like all antidepressants, it has a black box warning for suicidality. If individuals ever do have suicidal thoughts or thoughts to harm themselves, it's incredibly important that they seek immediate attention. And if you believe that this video pertains to you in any way, please see a medical professional.